I'm Dr Emily Marchant, an ESRC postdoctoral fellow based at Population Data Science at Swansea University, where I specialise in children's health and education research. I'm excited to share the findings from the Happen Wales Primary School Network's latest collaborative research study. In our study, we wanted to examine whether implementing school-based measures to reduce the spread of COVID-19 impacted outbreaks in pupils and staff in primary schools across Wales. To do this, we conducted an online survey where over 350 school staff from 59 primary schools reported which operational guidance measures were in place at their school in 2020. These measures included wearing face coverings, social distancing from staff and pupils mixing at breakfast, after-school clubs and playtimes. We then, using the SAIL databank, anonymously linked these responses to routine COVID-19 PCR testing data of pupils and staff. We also examined the impact of these school-based measures on staff-reported cold symptoms, anxiety and depression. Our findings suggest that an increased likelihood of COVID-19 outbreaks in the school was associated with more direct contacts outside of the household and a trend to self-reported cold symptoms. We did not find evidence that wearing face coverings, 2 metre social distancing or stopping children mixing was associated with the lower odds of COVID-19 or cold infection rates in the school. Wearing a visor and reporting more contacts outside of the household was also associated with depressive symptoms using the validated PHQ-9 scale. Primary school staff found teaching challenging during COVID-19 restrictions, especially for younger learners and those with additional learning needs. For example, wearing face coverings meant standing closer to pupils or speaking louder in order to be heard. Our study highlights the barriers and the challenges schools faced in implementing measures within operational guidance at the time. As we look to emerge from the pandemic, governments continually review available evidence to inform risk-based approaches to education delivery that safeguards children's learning, health and well-being, and supports school staff. Considering this study's findings, governments must consider the risk of transmission and the impact control measures can have on the health and well-being of pupils, teachers and senior school leaders. This research, supported by Administrative Data Research and Health Data Research Wales, forms part of wider COVID research conducted through the Happen Wales Primary School Network during the pandemic. Other studies included the impact of school closures from the perspectives of primary school staff and the effects of these school closures on children's health behaviour. You can find out more about our research on our website www.happen-wales.co.uk.